Welcome to this third episode of Pharma Decrypted. Today we're going to talk about storytelling, and I have a very special guest with me, Laura Kennedy, who is an expert in marketing excellence with a past pedigree that includes working for Novartis and Boehringer, among others. So Laura, thank you very much for joining us today. My first question around our topic today is, when you do your product launch, we are going to discuss what is the need for a clear scientific story. And I believe you've penned a lot of your ideas into a new book that's about to be published. So we have an exclusive here today. And I'd like, first of all, to hear about why you thought it was timely to publish such a book. You're muted, but that's always like that when you're...
Sorry. Thank you so much.
When you're live.
So the book is really an acknowledgement of all the time, effort and investment in omni-channel and digital transformation over the past couple of years, but to really speak to, that broad recognition that healthcare marketing still isn't delivering consistently the level of impact that we would want it to deliver. Both me and my co-author, Claudia Adriani, have worked in the industry for a combined experience of 40 years. And in that time, we have worked side by side with marketing teams. And what we've observed is that teams are often very activity focused in their marketing, which means that teams are often just trying to do too much, not knowing what's really driving impact and what maybe isn't. And the impact of that is, when sales maybe aren't reaching what they would expect or reaching targets, the answer is to do more and drive harder, without necessarily delivering the impact. And so that was the major reason for writing the book.
So this is really interesting, because there's a lot of complaint at the moment that there's too much noise around, professional activities such as marketing excellence in pharma, but also, on the other side, when medical people have to engage with doctors, the same applies, because there's so much noise. And this really seems to echo what you're saying, that actually it's time to rethink, and it could be that less is more. So what is actually the book bringing to the conversation, from a perspective maybe of a brand manager who is trying to do too much? What can we expect to read?
Yeah. So the book is really calling for a shift in activity-based marketing to insight and impact-based marketing. That's what we're really calling for. But how do we achieve that? We achieve that by having knowledge of and practicing what we've defined as 6 fundamentals. So these are 6 core pharma marketing fundamentals that we've defined. Now, every company has their own way of planning. They have their own different templates, etc., etc. But these 6 fundamentals are really sitting a level above that. And what we would say is that it's really important that every marketer, every cross-functional member of the team, not just marketing, has an awareness and understanding of these 6 fundamentals as a starting point.
Okay, so now you've piqued my attention. Are you saying that these are the general marketing fundamentals, or are they specific fundamentals applied to pharma marketing?
So because they're fundamentals, they are true to any marketing. But I suppose what we observed was missing was, how do you apply those fundamentals in pharma marketing? So we definitely speak to that in the book, but it's not a how-to book. What the reader leaves with is a really clear idea of what these 6 fundamentals are and what good looks like. And they will remember the 6 fundamentals, because in each chapter we give both a consumer and, where possible, a pharma example, so that it's kind of distinct and memorable. You'll remember, yes, chapter 3, that was about strategic choices. And there we saw the example of how Tesla has won by making strategic choices.
So this really leads me to my next question around, can we learn some of these tactics from, mainstream products, which are not pharma products? And I mean, perhaps you could give us some example of the core driving principles, some of those core driving principles, maybe around customers.
Yeah, absolutely. So I think one of the things that pharma marketers have always struggled with is, okay, there's the principles of marketing in the consumer world, but pharma marketing is very different and very bespoke. So we definitely speak to how do you marry the two together. So the book is created specifically for pharma marketers. But across the 6 fundamentals, so it's called the Bridge Framework, we're covering mapping of the market, deep customer understanding, strategic choices, the brand narrative or big idea, the guided experiences, and E, which is evaluate, which is measure for impact.
Okay, so today I think we would focus specifically on the need for a brand narrative. Could you give us an example from the wider world where a brand narrative has stuck through the brand, through the decades?
Yeah, absolutely. I mean, there are lots of examples. The one that people would probably be most familiar with is the example of Dove. So this is a great example where customer insight was used as the foundation for a brand idea and a brand story that has stood the test of time. I mean, that product is essentially soap with a bit of moisturizer in it, and yet Unilever have defied all expectations with that brand. So what was the core insight that they built that brand upon? And it was back in the 1990s, there was this a lot of these very thin supermodels around, the heroin chic, if you like. And what Unilever identified was that women were looking at these models and saying, I don't look like that and I will never look like that. And what that brand is really doing in the real beauty narrative is saying, you don't have to look like that. No matter what shape or size you are, you deserve to feel beautiful.
Mm-hmm. Okay, so that has withstood the test of time because it's a universal truth that affects every one of their customers, and maybe that's really the angle. The need for a narrative is because the way customers respond is such that if you don't tell them your message through a narrative, then they will not respond, because we are hardwired for responding to story. I mean, is that the kind of angle that you're coming from?
Yeah, I mean, we cover this in the 4th chapter of the book, but in essence, as you say, human beings are wired to respond to stories. What they're not wired to respond to or remember is disparate facts and figures. And one of the traps we can fall into, because we think our brands are so brilliant, and they are brilliant, is that we want to tell the customer all of these wonderful things about our product. But what we're not doing is bringing the customer into the story. And a great brand narrative has the customer at the center of their story. And in order to do that, and again, we cover this in chapter 1 and 2 of the book, we've got to understand the lay of the land of the market. We've got to understand who the customers are. We've got to understand what they're doing and why they're doing it. And we've got to segment the market. And then we've got to go really deep on our understanding of our target segments. So not only what are they doing, but why are they doing it? Not just at a core functional level, but at a social, emotional, and contextual level. What does it actually feel like and look like to be that customer? We've got to kind of walk in their shoes, if you like. How do you practically do that as a brand manager? Well, we'll probably speak to that, but you want to create space in your diary throughout your planning calendar to come together with your cross-functional team and examine things like the patient journey and all the customers that, all the stakeholders that intersect that journey. You want to look at your quantified flow, and you want to go really deep in your understanding of those target customers. So using frameworks like jobs to be done, for example, to really examine, go deep on your understanding of those customers' needs. And then you'll start to really feel what it's like to be that customer. You'll have a much deeper appreciation. And that's a core anchor for any great brand narrative.
What's the role of insights? There's a lot of surveys being done with healthcare professionals. I mean, do they inform your brand narrative? Are they an essential part, or are they just a nice to have?
They're part of the picture, right? What they're telling us is part of the picture. But a customer is never really going to tell you. They may do. There may be instances of them telling you something which gives you a clue, but it's really about taking all of the data, all of the information in your team's head, all of their sentiments and assumptions, all of those things, taking all of that and as a team bringing it together and making sense of it and saying, this is the core truth, or this is our assumption around a core truth.
Okay. And are you suggesting that you would then, once you have a good idea, you've done your background research, you put yourself in the shoes of your customer, you can then start reverse engineering some kind of story where you have a start, a middle, and an end? Or is it just a conceptual story? What's the best way to proceed?
So you need the right inputs to bring it to develop your brand story. And the first thing, yes, is having that understanding of your customer. You need to know who your target customer is. You need to have a brand positioning that speaks to not only the functional needs, but the other contextual needs of those target segments. And importantly, you need to know what it is you're trying to achieve. So you need to know what the customer is doing today and what it is you want them to be doing tomorrow. We call that the A's to B shift. So that's what we're going to try and achieve. Once we have those ingredients, if you like, we can begin developing the brand story.
So are you suggesting that we are bringing the customer along a journey from A to B, and the narrative is the kind of path that helps them undergo that journey and change their behavior or their attitude or their beliefs towards a particular disease area or towards a particular product?
Yeah, so the brand narrative is distinct from the funnel or the customer funnel. The brand narrative is something we develop at the start of our, if you like, our omni-channel planning. We would then subsequently develop our customer journeys, which is really about moving customers through from awareness to familiarization with the product to first trialing, etc., and to advocacy. The brand narrative itself is a story that we create. To use the language of an author or a playwright, we would create a story where the customer is the protagonist and everything that the customer struggles with, their pain points, are the antagonist. And then the brand is almost like the Yoda to the Luke Skywalker in that story. The brand is the thing that's going to help the hero, which is the customer, right, to fight off those pain points. And what we're doing when we create that type of story is we're really putting in front of the customer the possibility of a better future for whatever it is they might be struggling with. It could be something very simple. It could be something very complex.
Right. Okay. So what would be your advice to brand and product managers who may be starting afresh and look for new ideas? I know the concepts are not new, but the way you apply those concepts to pharma really need to be looked at quite systematically, and otherwise it's not going to work.
Yeah. Well, the first thing is don't jump to execution too quickly. Okay. There are a number of things you need to do before you think about execution. And the first thing is, there are all those things I mentioned. So understanding the landscape, understanding who your customer is, what it is they're doing, why they're doing it. And then making sure that you're choosing the target segments for your brand. So that's where you can really grow the brand and deliver the most value, and you're positioning your brand accordingly and setting your A's to B shifts. So that's the theory, if you like. But really on a practical level for brand managers, it's about making sure that you plan in, have that space and time to come together with your team to develop all of those strategic assets, to do it as a team together. And that's not easy when you're doing it for the first time if you've never done it before. So by all means, call in some support or whatever it is you need to do that, but do it yourself and do it with your team, because it's really important that You as a team own all of those assets. You're developing all that insight together and developing all of those lovely strategic assets together and developing your narrative together.
Right, so that makes a lot of sense. It remains a team effort, no matter what. And what you're suggesting here is that the planning really is what's going to make the success of your engagement with HCPs, because without planning, you cannot align the brand narrative, let alone develop it, because everybody in the team can have some input into what flavor that brand narrative would have, and what are the specifics that makes it unique and differentiate from everybody else's out there.
And just to say, Sabine, that is all the more important in the context of omni-channel. Before, we could get away with maybe giving our baby away to an agency and getting them to develop the positioning for us. But no, we can no longer do that, because our omni-channel planning is designed to be iterative. So it really must come from us, and we must be really, really familiar with it in order to understand if it's working and what it is we need to adjust about it.
Okay, so that's really interesting, and that leads us on swiftly to the next question, which is around when you do have to scale through omni-channel communication, there's element of capacity that come into play. And how do you roll out that brand narrative? And do you believe that, for instance, AI has a role to play to scale up the digital stories that will derive from your brand narrative into digital assets populating your customer journey? I mean, what's your position on this particular question, which is really hotly debated online?
Yeah, well, first of all, to say that AI has a role across all of our planning. So when it comes to developing insight, it has a role. When it comes to segmenting the market, when it comes to developing the positioning statement, it can even help us with the brand narrative. It can help develop several iterations or slight different types of brand narrative that we can use as a jumping off place to decide which narrative we're going to use. And then, yes, once we've decided on the narrative, AI can help us deliver that narrative consistently across touch points. And consistency is so important here, because once we decide what our narrative is, it's important that we deliver that in a compelling and consistent way. So it's going to take time for the customer to take on board. So we need to give our customers time.
We have a guest.
Yes.
Fantastic.
The final point, sorry.
This really goes to show this is live, and there's nothing more authentic than the welcoming of your favorite pet. So authenticity is
never work with children or animals.
It's such an important aspect of customer engagement, because for customers to respond to whatever message you have, if it doesn't sound authentic, if you can't distinguish it from something that would be generated by an AI but not checked by an editor or not checked by a human judgment along the line, then you're just producing slop, and slop competing with slop is not going to go anywhere. I mean, this is really an essential aspect of HCP engagement nowadays. I think pharma teams are rowing back a little bit, trying to deliver fewer digital stories, but those stories that they indeed share are more in depth, more researched, more polished, maybe a nicer KOL video that has a lot more insights because it's lasting a few more minutes than your average 1 minute video. Perhaps a more in-depth infographic that look at several angles in terms of patient quality of life, efficacy, and how this is going to change the overall picture for a HCP prescribing such and such drug. I mean, I think that there's a lot to be said around less is more. But so if you were to advise a marketer that has a new product launch, what would you look at first?
Well, the key thing is to get familiar with the fundamentals. I would say, what our promise with this book is that if you are aware of and practicing these 6 fundamentals, you're going to go an awful lot further along towards what we would consider marketing or launch excellence. So definitely the first thing is to get familiar with what those fundamentals are and really understand what it is that they mean, and why they're important and what good looks like. So having that appreciation and awareness first of all. And then, avoid jumping into execution, right? Make sure that you're protecting that time to really understand your customers, really get close to and familiar with your customers. One of the benefits, again, of doing this beyond the brand and the launch itself, in doing this exercise of understanding customers, you get an awful lot closer to them. And when you're closer to customers, you understand better what it is they need and how to deliver it. So you're much more likely to deliver what we would call a great customer experience, because you're understanding your customer better and therefore you're delivering what it is they need. So that's where you surprise and delight customers in the smallest of ways.
But one of the questions that marketing manager often ask is how personalized should the engagement be? Because you're not going to be personalizing at the level of the individual itself. I know it can be done, and there's IT systems that allow you to do that nowadays, but it's not a necessary step when you have the ability to segment thinly enough your audience. I mean, what's your take on this?
So the answer is it depends. It depends on no, but it really does. It depends on the life cycle of your drug, where it is in its life cycle. It depends on the business challenge. So those things are going to determine the level of segmentation you develop in the first instance. And then when it comes to execution, yes, your capability is very important in terms of the tech stack, etc. But even if you have a really sophisticated tech stack, delivering all sorts of individualized journeys isn't necessarily the right way to start. In fact, start simple if you're going to start anywhere and build from there. But again, it will depend. For a launch product, you're much more likely to be starting with maybe 3 or 4 individualized journeys. Whereas for a more mature product, you might be just focusing on the segment that you believe will drive growth. So again, it does depend, but starting as simple as you can is the best way to start, because once we have 3 or 4 different journeys, the complexity can build up very quickly, especially when you consider you might have one customer journey that has 3 different channel preferences. Particularly, what we want to avoid is sort of 64 different customer journeys. So I would say start with relevance as a priority. So who is that segment and what is it they're struggling with, and make sure that your customer journey is relevant to them and it's going to move them through that adoption cascade. And then worry later about the channels and the timing. Get that right first.
Right. Okay. So I think we've covered pretty much the ground, and the core message here you're sharing it with us today is really go back to fundamentals when it comes to marketing, and do be specific when it comes to pharma. Insofar as you need to do your homework, you need to understand your customer. I mean, nothing new under the sky, but the reality is a lot of the teams nowadays are so obsessed by meeting their KPIs, their click-through, their open rate, that they do lose sight of the fact that if you don't understand who you're talking to, you won't be able to deliver a message that resonates. And that seems to be exacerbated with the advent of AI, where people say, oh yeah, sure, I can write an email with a machine in 30 seconds. And well, nobody is going to want to read that message, and they might even use a machine to summarize your message and read the one line that says this is what this message is about. So if you start playing games with your audience is going to start playing games with you. I think that's quite that wouldn't be surprising. I have one question from the audience today. What is the most common mistake you see that new brand and product manager actually make in their initial years?
Yeah, this is an interesting one. And we talk to this in the book, but really, in our industry, a lot of people tend to start as sales reps, and then maybe they get promoted and move into the office, and then they start as a brand manager, and they don't necessarily get any formal training. And then they may be learning from a manager that hasn't necessarily had any formal training either. And so if there's a culture of activity-based marketing, this new brand manager will just fall in line with that. And start picking up those practices, which aren't necessarily fully optimal. So I think what I would say to new brand managers is think for yourself, educate yourself. By all means, read the book, but do whatever you need to do to understand what
Right.
these fundamentals are, to appreciate them, understand, and don't be afraid to question things, to think for yourself and question the norm. That's the only way we're going to, create that consistent impact that we want to deliver, because it's so important, right? What we're doing is impacting patient lives. So don't be afraid to speak up and challenge the status quo.
And do you believe that having team members that come from other industry makes a difference?
Oh, absolutely. Absolutely.
Could you
Huge.
share some examples that you may recall?
Yeah, I mean, when I worked in Novartis, I worked with people who had come from consumer marketing, and it really opened my eyes. This brand narrative for example, was something that I just wasn't familiar with, because I was so used to delivering these sort of facts and figures. Our detail aids always follow the same flow, which was create the problem, answer the problem, efficacy and safety and ease of use. And suddenly I was being introduced to this idea of a narrative where we were actually bringing in a really interesting story that we could be really creative with. So, that's a great example. And then, across channel use as well, working with people who'd worked in media and different content marketing. There was a lot to learn. So yeah, is really valuable. Unfortunately for us, I think what happens is when people come in from outside of our industry, they get so fed up with the pace of how we do things and how slow we are to change that they often get fed up and leave, which is a real shame, because they have a lot to offer.
Okay, so I think that's a perfect concluding comment. Thank you so much, Laura, for today. And we will be posting this in our YouTube channel for those who haven't had a chance to watch it in its entirety. And as of next month, we'll be welcoming a colleague of yours from Novartis, Christina Finazzi, who's a global event manager. And you will certainly be able to register in the next few weeks. So thanks very much for your time, and see you soon. Bye-bye.
Thank you so much.